Good morning, good afternoon, and good evening, depending on where you are in the world. You are listening to us today, and welcome to the workshop presented by Good Shepherd Australia New Zealand on innovations to support women and children experiencing family violence. It's great to be here with you all. To begin our time together, I'd like to acknowledge the traditional owners of all the lands that we are meeting on. For me, these are the Wurundjeri people of the Kulin Nation. We honour all their traditions and custodianship as being the oldest continuous culture in the world. We pay respects to elders past, present and emerging, and any elders that may be present with us today. My name is Gendry Klein-Brittler and I'm the Mission Director at Good Shepherd Australia New Zealand, and I'll be facilitating the session for you today. In relation to our topic, supporting women and children experiencing family violence, it probably took for a number of children and women to be killed by their ex-husbands or partners for Australia to hold a Royal Commission, an inquiry into family violence and why so many people could not be kept safe. The Commission inquired into the root causes and gaps in providing safe responses to those experiencing violence within the family home. In broad terms, recommendations from the Commission included improvements to prevention of violence, legal reforms, practice responses, and overall a common understanding of family violence risk and how best to manage it. In the first session today, we will hear more about what the Royal Commission uncovered and how this has influenced legal reform. And in the second session, 3 Good Shepherd practitioners will showcase new program responses to assist women and children who are in the midst of family violence. These causes and responses may be similar or different for you in your local setting. During the session, if you have pen and paper with you, perhaps note down some thoughts. If you're hearing any similarities to your own experience in the country that you are in, or what is different for your country community. Any questions that might arise for you, because at the end we'll have time to share some responses and ask some questions. So now I'd like to introduce you to Janine Evans. Give us a wave, Janine. Janine is the General Manager of Safety and Resilience at Good Shepherd Australia New Zealand, and Livia, who is our Service Excellent Lead at Good Shepherd Australia New Zealand. So I hand over to you both to share with us this morning. Thank you.
Hi everybody, it's really lovely to be here. We're just going to work out how we share the presentation, and hopefully this will, what was it? Where we gone? That one, there we go. Showing the IT skills. Okay, let's hope this is working.
We can see.
Yes, good. You can see it's all working. Great.
Yes, it's all good.
Just like Gendry, I would like to acknowledge the traditional owners of the land, and I'm on the same land that Gendry has spoken about, and that is the land of the Wurundjeri people of the mighty Kulin Nation. And in acknowledging this, I pay my respects to elders past, present and emerging, and those Indigenous people who are with us today. So as Gendry spoke about just a moment ago, we're going to cover some of the Royal Commission. We're actually talking about the Royal Commission into Family Violence in Victoria, a state within Australia, and now 5 years on. As you can see by the content page and the overview, we've got a lot to cover. We begin with providing some context. So Livia's going to speak about why we thought it was a good idea to have a Royal Commission in Victoria, the process that happened, how we went about that, the recommendations, but I'll only speak to a few of the recommendations. It was actually a very, very broad scoped Royal Commission and lots of recommendations came out of it. So we'll focus on those that have been particularly impactful for the work that we do at Good Shepherd. We'll look at the pathways, discuss how things have changed in the way that we use, way that we work with, and the way that we view those who use violence, and in the language that we use here in Australia, it is perpetrators. We will speak to the reforms in the way in which we respond to diversity, in particular, how we work with and respond to lesbian, gay, bisexual, transgender, intersex and queer communities. And we'll look at some prevention strategies. The second part of the presentation is about law reform, which has been really important and really, really significant and changed the way in which we work. We'll talk about the information sharing, the multi-agency risk assessment and management legislation, the risk assessment and management panels that we have here in Australia, and finally, I'll speak to the court-based reforms, focusing on the specialist family violence courts. Intermittently, we will have time to have discussions around the way in which things are done, perhaps in the country in which you are in. And we will have some question time at any point in time when we're in the discussion area, you know, speak out and ask some questions. And I hope you find this session informative and useful. And I'm going to hand over to Lydia now, who's actually going to talk to us about the context.
Thanks, Janine. So why did we have a Royal Commission in Victoria in the first place? I think Gendry alluded to the fact that there had been many family violence deaths, probably too many, as well as many families at risk where it didn't get to that point, but clearly the impact of family violence is significant on all families. In particular, there was the tragic death of an 11-year-old boy named Luke Batty in 2014. He was very violently killed by his father in a very public place, and there was a coroner's investigation into that death. Although the coroner who investigated acknowledged that no one other than his father was responsible for his death and that no one could have predicted that death, he did say that there were opportunities that were missed, and he made 29 recommendations based on the missed opportunities. Those recommendations went on to be included in the Royal Commission into Family Violence, and in particular, the three that we have on the presentation screen are that there were many professionals and agencies involved with this family, but they didn't share information about risk and safety, and they didn't coordinate their efforts or have a common way of assessing risk. So the coroner pointed out those things in particular, that lots of agencies were involved, they didn't share information, and they didn't have a common and shared understanding of how you assess risk. He also said that more needed to be done to ensure that people who use violence are visible, accountable, and held responsible for their behaviour. And the other thing that we want to focus on that. We want to focus on the accountability measures that are now in place for people who use violence. And he also pointed out that there was a need to stop expecting women at risk of family violence to supervise or manage the behaviour of the perpetrator. And what you will hear us talking about a little bit interchangeably is using the term perpetrator alongside people who use violence. Some organisations and places prefer not to use the labelling term of perpetrator, and we'll talk about a person who uses violence, but certainly in the family violence sector, the term perpetrator is most widely used. So we'll use probably a little bit of both as we speak to you. Thanks. So there were 227 recommendations that came out of the Royal Commission, and it spanned approximately a year. So it began on the 23rd of February 2015, and the final report was delivered on the 29th of March 2016. The terms of reference, and Gendry alluded to these, were to identify the most effective ways to prevent family violence, improve early intervention, support victim survivors, particularly women and children, make perpetrators accountable, develop and refine systemic responses to family violence, better coordinate community and government responses to family violence, and find ways to evaluate and measure the success of the many strategies, policies, frameworks, programs and services that are in place? How do we measure that they are effective? You can see that there was a significant investment in the Royal Commission in Victoria, approximately $13.5 million dedicated to the Royal Commission, and across that year, written submissions were received, almost 1,000. They conducted 44 group sessions. They held sessions with private stakeholders and expert roundtables. There were 25 days of public hearings. Victim survivors were able to give evidence at either public or private hearings. That was determined by them and in whatever way they felt comfortable. And there were 2 research reports that the Commission requested. One report was on family violence trends, and the other was on understanding family violence proceedings in the Magistrates Court. So that's how far-reaching this this commission was. Okay, so as you can see, it was a fairly lengthy and a very broad-scoped project. And as been mentioned before, there were 227 recommendations. And the Victorian government promised to respond to and actually act on all of those recommendations. Now, you know, this was a first, really. So we are now 5 years into that plan, into the implementation of the rolling action plan on the Royal Commission. And Good Shepherd delivers a number of family violence services. So we're very impacted. And I guess one of the big things that we do talk about, we touch base, we touch some of these areas because there's 29 reform areas. We won't be able to speak about all of them, but what we will do is speak about the ones that are very significant for the work that we do at Good Shepherd. But as you can see, it's really highly comprehensive. So there was looking at a safe home, and that was really about women being able to particularly remain in their home, and if that wasn't possible, what else can we do in the housing space? We focused on our First Nations people. We looked at they looked at adolescents who use violence, children and young people and their experiences of being exposed to family violence and experiencing it themselves. Court-based responses, we will expand a little bit more on that. Data, research and evaluation, very important because it informs everything in the evidence bases. Faith communities, family violence and diversity. Livia will speak a little bit more about that as we go into this. Family violence and the child protection system, family violence and the law, and we will speak a little bit more about law reform. Industry planning, information sharing was a huge piece. There's a lot in there that Livia will speak to a bit later in the presentation. Investment, how much money are we going to need, or are we going to have to invest in this? That was an area that was looked at as well. The LGBTI, which it's the acronym that we use here in Australia for lesbian, gay, bisexual and intersex communities, and we will speak about that. That's been a significant reform for us. Male victims, offences and sentencing. Older people, that's also been some significant work that we're doing here in Good Shepherd, but we won't be able to go into that one. Pathways to services has been one of the bigger pieces, and we'll speak to that. People from culturally and linguistically diverse communities, people with disabilities, the perpetrators or the people who use violence, and I will speak to some of the reforms in that area. Police were a lot of work. A lot of work was done with the police, looking at the frontline operations and the workforce, also looking at leadership, resourcing and their organisational systems. So there was huge changes and reform there. And it actually does, some of the things we talk to touch the police and the work that we do with police. Prevention, which I forgot to highlight, we will speak about prevention. Recovery and financial security. Restorative justice for victims of family violence and review of family violence related deaths, the risk assessment and management, with which Livia will go a little bit more in depth to, and what are the experience like for rural, regional and remote communities. So like I said, one of the big pieces that was really significant for the work that Good Shepherd does was in the pathways. As a family violence provider, some reforms occurred in pathways, enabling it to be
easier for people to find their way into services. And Livia will just speak a little bit about what that ended up being.
Thanks, Janine. So going back to what the coroner said, the coroner who investigated Luke Batty's death made a comment about how many services were involved and how uncoordinated they were in how they shared information and collaborated. The Royal Commission, following on from that, identified that there were many ways that a person might disclose their experience of family violence. They might tell a teacher, they might tell a doctor, they might disclose it to a counsellor or a nurse. There may be police or child protection involvement. So many ways that that person might disclose their experience of family violence. The service system was described as being so complex and siloed that it was difficult to navigate, and that really a person probably needed a support worker if they were going to navigate their way through that complex system. Family violence services were not visible, and this was stated as well by the Royal Commission. And probably one of the reasons for that was that family violence services, in their efforts to try to keep women and children safe, were not visible because visibility increased the risk that a perpetrator of violence might find that woman. So services tended to do their best not to be visible, but in doing so, it became difficult for people who needed support to find their way to those services. So the Commission recommended that there must be clear entry points into and pathways between different parts of the service system to make the experience of those seeking help seamless. The recommendation was to establish a support and safety hub in every region of the state of Victoria, 17 in total. Support and safety hubs are now known as the Orange Door, and in fact you may be asking why orange, and we asked ourselves the same question. The reason they are orange is because consultation occurred with victim survivors who were part of an advisory group and a co-design process, and their preferred colour was orange. So that's how they became Orange Doors.
I think because orange has been associated with safety. So I'm not sure about in other countries, but over here we would wear an orange vest with a big stripe, you know, an iridescent stripe over it. So orange is a colour in Australia that is associated with safety.
Thanks, Janine. So on the screen, you can see what the Orange Doors were designed to do. So the first thing is that they are a single area-based entry point into specialist family violence services, perpetrator programs, integrated family services, and they also offer referral to any other support services. They are that entry point. They hold perpetrators accountable by sharing relevant information, keeping them in view, and engaging with them, trying to engage them in services and programs to get them to address their violence and their use of violence. The other thing that they do is they have a system-wide view of services that are available. So they can point a client in the most appropriate direction and to the most appropriate service where they know that capacity is available to support them. And finally, they bring together critical information for the assessment and management of risk. So those areas that I mentioned around family violence services, specialists for men and women, perpetrator programs, family services, children's services, all of that information comes together in the Orange Door. And I'll talk a little bit more about the information sharing part of that a little bit later. I also am conscious that Sakina is one of our Good Shepherd Orange Door practitioners, and she's going to, in her presentation, share a little bit more about the Orange Door and give us a view from the perspective of a woman and children who use the service and come through the service, to give a really good case example of that experience. So she will do that a bit later. just to give you an idea of the size and investment involved in the Orange Door, or the Orange Doors, $5 million was spent for the design and planning. $448.1 million was spent over 4 years to establish the 17 Orange Doors across our state. And currently there are 7 operational. Good Shepherd was actually part of the very first one to launch. 6 Orange Doors are expected to open this year in 2021, and the remaining 4 areas are expected to be operational by the end of next year. Just a little bit of data about information and referrals. As at October 2020, over 110,000 people, including over 43,200 children, have been referred to or directly sought help from the Orange Doors. And keeping in mind that we're talking about 7 so far, so one can only wonder how much bigger that's going to get when all 17 are operational.
Thanks, Lydia. And actually, when we talk about Good Shepherd, we are probably one of the biggest providers in the Orange Door with, I think we've got up to around about 25 staff, frontline staff working there in intake and assessment, and 4 or 5 team leaders, I think, and a coordinator. So it's actually, and we are one of 8 agencies in the Orange Door in which we deliver services. So one of the other areas that we've mentioned a few times here was perpetrators, or the person who uses violence. And the aim of this reform was to develop a system-wide approach to keeping perpetrators, or the person who uses violence, accountable, connected and responsible for stopping their violence. As you can see, if you can see this picture that they've got up here, it's the web of accountability. And the approach has been to mutually reinforce the message and responses that the perpetrator, or that person who uses violence, to always keep them in view while continuing to ensure that the victim survivor is safe and well. So taking into account their safety and well-being. And I think if you think about it before, it had often always been the burden was on the victim survivor to look after themselves rather than focusing on the perpetrator. So they made a real effort to say we need to keep focusing on the perpetrator, and that has been across every part of the reform. But in the way that they felt that they would achieve it was through community messaging with community members, including faith-based organisations, workplaces, bystanders, neighbours, the media, sporting clubs and support services, police and courts. This work also plays into the prevention piece, as I mentioned before, and I'll speak about that later in the presentation. But it's very important that constantly the conversation goes back and the question goes back to the perpetrator. An example around how it was done in prevention was around messaging for bystanders. So there were some media releases out there where they showed and encouraged people to talk up and speak out and call out when behaviour was not okay, particularly with men. So giving them examples of how you might do that in media campaigns that they used. Some of the service sector areas that come into contact with victim survivors are actively encouraged through the tools and the messaging to always keep the person who uses violence in focus. Now, this has been a really big piece of work with the police force as well. We had to educate the police force on the dynamics of family violence and not just revert back to the idea that it was just a domestic and why doesn't she leave? We're trying to breed a new police force or a new police officer who should be asking, why is he using violence and what mechanisms can we use to hold him accountable while still keeping her and the children safe? So this is fairly significant. And as you can imagine, it's a really big cultural shift that's going to take time. So this piece about the perpetrator does cut across everything, and it is a huge focus of the prevention work. There's a concerted effort to tilt the focus towards the perpetrator, and this is played out in our work. So as I mentioned before, the use of the multi-agency risk assessment and management framework encourages you to think about the perpetrator and the person who uses violence. the way in which we work in the Orange Door, as Lydia spoke about before, and Sakina will speak more to about how we don't just work with the victim survivor, we are getting and gathering information around the perpetrator so that we can make informed decisions. And one of the key ways of doing that was the central information point. Lydia does talk about that in a little bit more detail, but it's been a very significant reform for us that has enabled our workers to get and gather information about the perpetrator. So when we're making decisions and managing the risk for the victim survivor, we are armed with a whole heap of information about the perpetrator from a number of service sector areas, including justice, police, and other agencies. The other way in which it is done is the specialist family violence courts have a focus on the perpetrator as well. And reforms with the police, as I mentioned before. So they are being trained to ensure that they focus on the person who uses violence rather than the victim survivor. So we've had a bit of, we've done a lot of talking.
Yes,
I think it's a bit of time, it's about time we sort of thought we would stop and have a bit of a discussion here around how perpetrators or people who use violence against women and children are held accountable in the country in which you're in, because we know that, you know, it's been a huge cultural shift for Australia, but we're really interested to hear how that plays out in other countries.
Thanks, Janine. Can I just jump in for a second and just say, really invite people to use the chat box. And if you're listening via YouTube, you can also write into the chat box and we can bring the questions forward into this, or the responses into this forum as well. So we have about 22 people on this in the room, but it's probably great if we can, if you have a question, or if you can have a reflection on this question, it'd be great to just share with the whole group. I think we won't break into groups. So we've got people from Malaysia, we have people from, where else, Teresa, do we have groups? It'd be great to hear from the different countries what the situation is there. So Malaysia, Singapore, US, Korea. So just fantastic. So it'd be great if someone from any of those countries would like to share how are the perpetrators or those who use violence against women and children held accountable in your country? What is the system in your country for people who... Or
are they not?
Or
are they not held accountable?
Yes. Okay, great.
Gendry?
Yes, Teresa.
This is Teresa. Yes, I just have a insight from when I heard the sharing just now about how even the police have to be educated, you know, as to the aspects of family violence, that it's not just a closed door event with just the family members, but it's something that the perpetrator has to be held accountable. So I just want to share that that runs across Malaysia as well, where we find women who go into the, who report to the police actually do not get the help that they need. Instead, they are told to go home because it's a family issue.
A domestic issue.
Yes, I just want to validate that point as well.
Yeah, thanks, Teresa.
Well, that has been that way in Australia for a very long time.
Yes. Marie-Jean, do you have anything to add from the South Korean perspective about how either the police respond or don't respond?
Actually,
yes.
Actually, very similar what Teresa said just before. It's very similar. In our culture, the family violence is especially the occurred family violence is very hard to interrupt. To handle it, especially policemen, they hate to involving this violence because the culture of Korea is family matters are family matters. So unless it's very, very serious and like a criminal things, they are not involving. So we have shelters. family violence shelters and counseling centers, and all we are involving to work this area. But very often, it's just the violence is not occurred one time. It's just continuously. Even they came to stay the shelter, and then when they return to their own home, they're few days later again. It's just like that. So it's very difficult to handle it.
It's been a challenge for many communities, I think, Mary-Jean, and that's right. So this is why the commission was so important in Victoria, because it challenged that system. Yeah.
Yes.
Absolutely.
Michelle from Cambodia, are you able to share what the situation is in your community? Not getting sound there. I'll come back to you, Michelle, if you like, or you can just put your hand up. Sashi, what about India? Have you any reflections from the India perspective?
In India as well, it's so much the same. It's so comfortably kept under wraps and never spoken aloud. So often when a woman or a child go forward to report, they're victimized, and they have become the object of the actual crime. That as if they are the perpetrators who brought it on themselves. So it's like the tables are turned back on the victim quite often.
Yeah.
At every level, whether it is a child or a young girl of 12 or 13, up to any age of women and even elders. Slowly, there is a shift towards the attitude towards elders. However, for women and children, there's a long way to go.
Long way to go. It's a huge cultural thing, isn't it, Sashi, too? And a systemic thing to shift a whole group of mindsets. Yeah. This is interesting that we're getting...
It was the same here in Australia. I have worked in family violence for over 25 years, and my early days of working in family violence, the police were very much, it's a domestic, it's a private matter. And I think I can, categorically say that is really shifting in Australia, isn't it? And the police work actively with us. And we will talk a bit later. We have Cassie, who will talk about a project where we actually work in the police station with the police, and they are listening to the views of women. So, the Royal Commission had made a huge changes and significant change here. We were starting to shift before that, but it does take, it's across, you've got to do the early intervention, early prevention work to actually challenge those gender stereotypes of it's this cultural thing of it belongs and stays in the home, and that it's the woman's fault for some reason. Yeah.
Thanks, Janine. I think Shirani has her hand up. She may want to add something into the conversation as well. Are you there, Shirani?
Yes.
Great. Great.
Yes. Even in Sri Lanka, the reason is that the women, they also, whenever you go to the police, they will not get justice, and also they themselves become another victim. Maybe they were not welcome in the police, and also the structure, the cultural structure is that the elders and their relatives think that they bring shame to their family if they are going to publish it among the society. So what I see, that's happening in Sri Lanka, not justice, not protecting them, not thank you.
Yes, thanks for sharing, Shirani. It just seems that what's coming through is that there are many barriers for women to reach out and protect themselves. And that's, as Janina said, has been a real issue for us. I see Raja in Thailand. Please join in and share your experience.
Yeah, as many other friends already shared that it's a culture issue. So it's the same in Thailand when there is a case of violence especially in the family. it's very difficult to get them to the court level because they saw it as a personal matter in the family. Even the police, they try to negotiate, try to not receive the case because they try to make the perpetrator and the victim agree on something. And sometimes the shelter, government shelter, like social worker, came into in the negotiation as well, so that they try to make them understand their law, etc. But it's very difficult to do that. And at the court level, there's no system of victim friendly system, so it's quite difficult for women victims who really got trauma already, and they didn't want to go to the court at all, and the case become like under the carpet and under report in Thailand. And that's why Future for Thailand has come up with a project started at the beginning of this year, supported by GSIF, to do the community-based protection mechanism in the project area. So we start to talk with the community member, community leader, to come up with a small unit or mechanism that the people in the community have a role to protect and prevent the violence in the community by themselves. So we are starting the project just last 2 months. So we hope that we can learn more from your presentation, how we can have an idea of the orange home. Is very interesting for us. Thank you.
Yes, that's great. We will have some very good examples later on of how we are doing our responses. But it seems that, you know, Teresa's got a comment there, education, and empowerment is key to ending the violence. Exactly. But what's coming through is that, like us before, there was a response to these critical deaths. This was very much seen as a domestic issue in the family. There are cultural issues. The responses were poor, and it stopped women from coming forward. So it's amazing. So it seems like our work mainly is at the level of supporting, giving a safe refuge, trying to support the women in a local level. But it seems that in many places, the system is not willing to work together to support. I'll hand back to Janine and Livia now, in case they have anything more to add on this part or want to continue, whichever way.
Gendry,
oh, sorry, Joan, yes, sorry, Joan from Malaysia.
I just wanted to clarify. So this would not have happened, the orange door kind of a system, you know, wouldn't have happened if the Royal Commission and the law, the system didn't change, right? Or make
absolutely.
Yeah.
Yes, so it was the Royal Commission that recommended it, and it would not have happened without it.
And I think the Victorian government being prepared, so we had a government that was prepared to say, whatever the Royal Commission finds, we're going to implement. So that was significant as well, because governments commission reports so often and then put it on a shelf and do nothing about it. I'm sure you've all heard those or seen those. So I think for Victoria to have a government to commit it, and as you see, the amount of money that has been spent, the Orange Door is a very expensive model, but it has raised the profile of family violence. And I guess and some of the challenges in that is be careful what you wish for in opening it up, because now you have to manage the demand and the flood, as Livia talked about, the numbers that we are seeing coming through the Orange Door, and being able to respond and do a good job for those women that seek help. And even the men being in view now, what programs and services do we have to actually respond to these men who are using violence to change that as well? So, yeah.
So, Joan,
so the coordinated, it has to be coordinated and systemic. Yes. It cannot really, a few NGOs working together.
On the ground up.
Not even
it's going to be a big government initiative, really, to get the real shift, isn't it? So I think that's what our presentation really shows, is that it was a big government shift in a number of areas, like 29 areas of reform that have you know, made the difference. And we are fortunate, I think, to work in a system where we have a government that is committed to it. So
and I guess the other thing is wherever we have dollar figures to share around the investment that's gone into those initiatives, we're sharing that as well. So $448 million Australian is not something to sneeze at. It is a significant investment in the orange doors, you know, without a doubt. So huge reform.
Okay, we might just move on, and we do have some time to talk towards the end and ask questions as well, and there'll be more spots to talk about some of these reforms. But Livia's going to speak a little bit more about one of the reforms that really focuses on diversity and how we respond to and deal with people from diverse backgrounds.
Yes, thanks, Janine. Before I go into one particular initiative, I do want to acknowledge that the Royal Commission made a range of recommendations to improve responses for older women, as Janine mentioned earlier, women with disabilities, women and children from culturally and linguistically diverse backgrounds, and Aboriginal communities. And in particular, funding for Aboriginal services is now built in as business as usual. So when the government puts out funding opportunities and tender opportunities, there will always be an allocation now for Aboriginal services. So they will get their own specific funding to support them in whatever area that might be. So where there has been funding for therapeutic services or legal services,
or
prevention or crisis accommodation, a proportion of that funding will always go to Aboriginal services now as part of the business as usual, which is terrific to see. Changes have been as simple as funding the use of interpreters and as complex as amending legislation to include forced marriage and dowry abuse as examples of family violence. The one that we want to talk about though today is Rainbow Tick accreditation, which is for the LGBTIQ+ communities. And before I go into that, I think it's important to acknowledge the additional barriers that they experience. We've already heard how difficult it was for all victims to access support services. LGBTIQ people reported experiences of homophobia, transphobia, and fear of discrimination. They are less likely to report violence, seek support, or identify experiences of violence. And the Commission heard that in one case, a refuge required a transgender man to resume living as a woman in order to gain access to the service. So that's how out of touch and how limited services have been to this community. And as a result of that, what the government has done is they have regulated and made organisations that are funded to deliver family violence services that we must go through Rainbow Tick accreditation. So all services that receive family violence funding must achieve Rainbow Tick accreditation. And to start that off across our sector, 20 family violence services and 6 Aboriginal services were actually provided with funding to undertake that accreditation. COVID affected us all last year, and it also affected organisations in their Rainbow Tick journey. So by June 15th last year, only 6 of the 20 funded services managed to achieve accreditation. Partially that was because of COVID, but partially it's also because the standards are quite rigorous and difficult to achieve. And I'm just going to go into the next slide to just describe what the standards are and what is expected of an organisation to achieve Rainbow Tick accreditation. So the 6 standards are organisational capability. So it's a requirement for organisations to demonstrate that they have embedded LGBTIQ inclusive practices across all systems and that they continuously seek out opportunities to improve them. Workforce development is the next one, which is about ensuring that all staff and volunteers understand their responsibilities to LGBTIQ consumers and are trained and able to deliver inclusive services. Consumer participation is a really important one, not just for this community, but certainly something that's important across the board. And that involves ensuring that they are included and consulted in planning, developing and reviewing our services. We need to ensure that our organisations are welcoming and accessible. The disclosure and documentation piece is around ensuring that LGBTIQ consumers, staff and volunteers feel safe providing personal information, including their sexual orientation, gender, identity and their status, because they know that that information will be treated respectfully and that their confidentiality and privacy will be respected. And then we need to ensure that services are culturally safe and acceptable to LGBTIQ consumers. So 6 really rigorous standards that are across the board and oversee all that we deliver in our services.
Thanks, Livia. So significant reform for family violence providers, for those of us that are providing these services, means that there is a rigorous process we have to go through. And it's not, you know, we have to do this because the sector tells us we need to do it. We want to do this because this is a good thing. You know, once upon a time we would have wouldn't have had to think about in a refuge, how do we have a women's refuge and a trans woman wants to come in here? There was a dilemma around that. Now the message is clear, is that you are welcome. You see yourself as a woman, you are welcome into this refuge, which is a great thing for all women. So what I'm going to talk about now is prevention. That's another area of reform, and this is a really big piece. It's quite a big topic with a lot of initiatives, and that started off with the establishment of an organisation called Respect Victoria. Now, this was a first of its kind because it's an organisation that's dedicated solely to the prevention of family violence. Respect Victoria undertook a number of campaign messaging in mainstream media, and most people here in Australia will remember those things on television and the messaging that we started to see all over the place. And it was really what underpinned it all was that it starts with addressing the gendered drivers of violence against women and other forms of discrimination. So the ads were talking about gender discrimination and discrimination. So the other thing that was really big, so they actually did it in the mainstream media, and what they're doing now, so it started off with that campaign, they're actually expanding those campaigns now to focus on women with disabilities, so representing women with disabilities, women from culturally and linguistically diverse backgrounds, so representing them in the ads and the stories that are being told and the way they advertise it around gender inequality, LGBTI and what that means for, and representing Aboriginal people as well. The other one that was really big in this area, there are a whole heap of reforms, I have to say, and prevention activities, so I've only pulled out a few that were quite big. And the other one was mandating the introduction of respectful relationships in schools. So Olivia's talked about the money that has been spent, and, you know, in this area, it's $37.5 million over 4 years so that we can create the next generation a culture of gender equality and respect. And so we really want to change the story of family violence in the future. We can continue to respond to the family violence that's coming through, but if we actually don't change the thinking about family violence and we don't have discussions at a national level around the drivers of family violence, then we know that things aren't going to change. So all Victorian government schools need to be signed up to the whole of school approach to respectful relationships. And that's fairly significant. The next generation of children will have a greater understanding around what this means to be a young man and respecting relationships, or both, you know, and what it means for women to what is not okay in a relationship. So the other thing is that after we're now 5 years into a number of prevention programs, and part of the work now is to scale up some of those prevention programs. So they were undertaken in multiple settings, including grassroots primary prevention programs that targeted men and boys, and they were delivered by men and boys. So these are men and boys going out at grassroots, talking to other men and boys around masculinity. So talking about respectful ways to promote healthy relationships and healthier masculinities. There were programs at local government level, ethno-specific programs, multicultural programs, and faith-based organisations were funded to deliver programs within churches, within wherever they did youth groups or things like that. So we really wanted to get to the ground level and provide a number of programs, and they were all evidence-based with evaluations. So they wanted to test and evaluate these programs, and now looking at which are the ones that made the difference. So if we ran a program for, you know, so I just know that we partner with an agency that's called Indian Care that works with the Indian population here in Victoria, and if they get funding to work in the family violence space, that those programs were evaluated into we right? So if we saw that we made a change, you know, that these programs were going to be scaled up. So the evaluation part of it was very important as well. The other one that was really significant is the Gender Equality Act of 2020. Now that came into a being, it's actually coming into being of the 31st of March. So it's about to now really come into play. It is about gender inequality in the public sector, universities and local government workplaces. We've also appointed a Gender Equity Commissioner to ensure compliance and ensure that the entities that are in scope, those entities that I talked about, develop plans and report publicly on how they're going towards promoting gender equality within the workplace. Now, they're very big workplaces when you bring in the public sector and universities into play. We're actually talking about a fairly large workforce that we really wanted some change in. So, we've just lost our little, there we go. So we thought, I mean, prevention is a really big thing, and gender equality, I think, we talked about it before, I think is one of the things that underpins, and if you don't have that gender equality, you get a different response from the police, you get a different response from anywhere that you go. We've heard that when we were talking about how it's responded to. So we wondered, what prevention strategies do you think would make the most difference in your country?
So Janine, there's been quite a bit of discussion across the Asia Pacific, particularly around this sort of gender balance and gender issues. So I'm sure a few people will have something to say, but I just wanted to say I love the part in this section which talked about having to change mindsets and thinking, and how you need to do that from the grassroots, and having school programs where kids are educated from a very early age to understand gender equality. I mean, that's quite a substantial contribution to shifting the mindsets of that might be cultures that have been embedded for many decades or centuries even. So to start shifting those mindsets and starting in those places is amazing. So if Willa, would you like to actually share your thought? You've just come onto the chat room, but if you're there, could you share what your thought is behind that statement, please? Willa, come through.
I hear in excellent talk, by the way. I really like listening how you made changes by engaging with local communities, the enforcement, police, which is really important, and also with the local government, and that affected the changes that we see happening now in Australia. I wonder, where do you think you would be now if those links had not been made in Australia? Thank you.
I think back to, as I said, as a practitioner for 25 years, we were improving a long way with the police. We had a police commissioner who was female, which seemed to change things a little bit, and there was a code of practice developed before the Royal Commission. But before the Luke Batty episode and the Royal Commission, as a family violence practitioner, I have to say, I felt like I was banging my head against the wall, and we still had to constantly deal with the cultural piece. So I think where mindsets were still about it being a domestic matter and that it stayed in the home. So that was, so the pieces of work that I think people don't realise is going on is changing the thinking and the undercurrent of how people view this. And I often think back to, you know, in law, when people talk about the rule of thumb was about the fact that a man could hit his wife with a stick no larger than his thumb. This was in law. So in our culture, it was built into our culture and in our law that it was okay to belt your wife with a stick. So it was in the psyche of our nation as well. And I think the Royal Commission has been is the biggest thing. And I think we are if you agree with me, I'm sure, Lydia, very, very lucky to work in a state where we are seeing this huge shift. But in saying that, it is a Victorian thing only, but it has influenced the rest of the country, don't you think? We've been lucky.
I think it has. And thanks for your question, Willa. I think the other reflection I have is that I recall the days before the Royal Commission when family violence services had no information about the perpetrator of violence at all. So, you know, every effort was made to try to keep women and children safe. But in the absence of information about where he was, what other crimes he had committed, what sort of risk he posed, it was really difficult to try to keep women and children safe. So I am going to go on and talk about the information sharing legislation and what's changed to enable that to happen. But I think prior to that, it was really challenging to try to keep women and children safe.
Before we go there, Livia, Alexis also has a comment or question. Come in, Alexis.
Sure. Thanks, everyone. I think speaking from the US context, there's a lot that can be done and that needs to be done in terms of our culture of violence. I think we have quite a pervasive one in the US. Today, somebody was able to walk into a grocery store in a state with an automatic weapon and take 10 lives. And last week we saw that somebody was able to buy a gun in one day, and then later that day take 8 lives. And so I think our country has so much in terms of this culture of violence, this gender inequality, the way that all of these issues intersect, the view we have of women, the view we have around race in this country. So there's so much, but I think 2 things that are really top priority in my mind, among many other things kind of happening at the same time, is a lot of work around our gun laws. There are so many states in this country that don't require background checks. And so somebody could, have been convicted of domestic violence in one state and then gone to another state where there's no background check and buy an automatic assault rifle. And so I think that's something that we see a lot of family violence advocates advocate for, is stricter gun laws. And I think around education in schools, there's still a lot of states that don't require science-based sexual and reproductive education. So there are states in our country, in the US, where it does not have to be factual, the information that you're sharing with young people about relationships or sexual and reproductive health. So I think those are kind of 2 big things for me, along with a lot of these cultural conversations that other folks have mentioned.
Thanks, Alexis. It's very clear by the conversation that this is an important issue that cuts across all of our communities that we're working with, whether it be Asia Pacific or the United States, and I'm sure other places as well. And I just want to, at this point, really thank you so much for contributing to the conversation, because it's great to see us all sharing what is happening and our thoughts and ideas. And I'm really appreciative that you're coming in and doing that. So please don't be afraid. If you've got a question or a comment, jump in. This is a really safe place to have a conversation. So I just might share with you that we have 25 people on YouTube at the moment. So those people on YouTube, please don't feel left out. If you would like to make a comment or you'd like to join the discussion, if you type into the chat box, Teresa will relay your question to us and we will happily engage you as well. That'd be great. So I'm going to hand back to, sorry, I have a question coming through from Maria. Do you engage the domestic violence survivors for your prevention advocacy programs? How?
Absolutely. Yeah, Lydia talked about, we have an advisory committee, but I also know, and I didn't mention it here, but in that we talked to, actually, I was going to say the Web of Accountability shows all of the systems, but it also speaks to where prevention occurred as well. And one of them, it was in women's health services, and there were women's health services who developed groups that had women with lived experience that input into it. And I think in Australia, the work that we're doing in all spaces really asks us to continually check in and involve those people with lived experience. So they play a huge part in the way things are being done, particularly in this Royal Commission, but in prevention in particular. So what would work, and you know, we're constantly asking those voices, and most of those projects would have people with lived experience having some input into it.
And Janine, you might be talking about this later, but you know, even in the refuge build, you engaged people with lived experience to share what would be the best kind of environment and what's the best environment for a refuge.
Yeah, so in creating and using trauma-informed thinking around what would it look like, how do we make sure that we create an environment that is actually trauma-informed and suits the needs and the best needs of women who've experienced family violence and have to live in crisis accommodation. So yeah, it's a really important thing to do. And we're talking about elder abuse, and we are building a refuge for older women who experience family violence. So it's a specific focused one, and that project is about to get built. And through that process, we will do, as Lydia mentioned before, a co-design piece that says, okay, if we're going to focus on older women from culturally, linguistically diverse backgrounds to remain in their community and still be safe in a high security women's refuge or a secure women's refuge, what sort of programs do we have to create? So we think constantly about now how we can involve the voices of those women who've experienced violence in from the very beginning, from the design of everything that we do. Mind you, that does cost money too. So, you know, these strategies, there has to be the commitment to it, because and they're principles around the way in which we work, because they're not, I mean, they're expensive, they cost money, but at the end, you're designing a program for the people who end up using it. So I think we're designing better programs as a result of that.
Thanks, Janine. I might invite you to continue in your presentation, and we can stop again a bit later for the next pause.
So the next bit we're going to talk about is the law reform. Law reform has played a significant part in the changes that have been made, because you can, you know, I mean, law can help it sometimes, putting it and making it legal, but and other times it doesn't. It's not always the answer, where you have to change the hearts and minds about people's thinking. But some of the changes in the law reform have been really significant in making this reform work across Australia. So Lydia's going to talk a little bit about some of the areas that we have had significant law reform.
Thanks, Janine. Beginning with the information sharing legislation, which I think is probably the most critical change that occurred and has made it possible to gather information about people who use violence in order to keep women and children safe. Privacy used to be more important than information that could be used to assess risk and safety. The legislation that was introduced has changed that. So the Family Violence Protection Act was amended in June 2014 to establish what is called the Family Violence Information Sharing Scheme, which means that information between organisations that are prescribed can be shared. And it needs to be relevant information. So it's not a sharing of everything. It doesn't mean that people have no privacy anymore. It is about sharing information that directly relates to family violence and risk, and is used to manage that risk, to keep people safe. What was said by the coroner who investigated Luke Batty's death is that sharing of information didn't occur, and that was a missed opportunity. The Royal Commission made a statement in its final report that I think is a great summary of it. It stated that sharing information about risk within and between organisations is crucial to keep victims safe. It is necessary for assessing risks to a victim's safety, preventing or reducing the risk of further harm, and keeping perpetrators in view and accountable. So I saw that in the huge report, and of course you can go and read the report. There are volumes of information there, but that was a statement that really stood out for me about the importance of sharing information. And it goes in two parts. So that bottom statement there is telling us that you can both request information and you are required to share information. So requesting information is generally information about perpetrators of violence, and that information can be shared, as it says, without consent. Sharing information may equally be that you as an organisation have information that you believe will help to keep a victim survivor safe. So you might be a service that is working with people who use violence, and you believe that the information you have about that person's intent or their mindset or their blaming of the victim places that victim survivor at further risk. You as an organisation are required to share that information with another organisation so that they can keep that victim survivor safe. So it's really critical sharing of information. The other scheme that was introduced was the Child Information Sharing Scheme, and its scope is broader than family violence alone. So the Child Wellbeing and Safety Act was also amended, and it enables prescribed organisations to share information to promote the well-being and safety of children. So it has a broader focus in that it's not entirely about safety or not about safety alone, but it's also about the well-being of a child, and that means it has broader scope. Information about children can be shared without consent. However, consent should be sought whenever possible. And the reason that consent isn't required for children is that there is acknowledgement that children sometimes have adults around them who are not necessarily able to keep them safe and may not share information that's required to be shared. So it is the state government, in a sense, and those of us who have state government funding who are in a position where we become adults whose role is to keep children safe. So where their families and adults around them are not able to do that, and they wouldn't share information freely, information between organisations can be shared wherever that's required for their wellbeing and safety. You can refuse or decline a request for information to be shared if it doesn't promote wellbeing or safety. And the examples of that we've experienced in our own organisation are that sometimes we've had files or records subpoenaed that are children's records from their counselling. So they've been seeing one of our family violence counselling, and a record is subpoenaed. And within that record, a child has shared information about past abuse or violence that's been perpetrated against them by an adult or their parent, it may be. That parent may be wanting to use that information for court purposes, and the information, if it were to be shared, might place that child at risk. So where we review the information and decide that it may place the child at risk, we don't share the information, and we can actually object to a subpoena. Janine mentioned earlier the central information point, and it has become possible because of the information sharing legislation. So as Janine mentioned, it brings together workers and information from court services, Victoria Police, Corrections, and the Department of Families, Fairness and Housing, who all have information that's relevant to family violence risk. And as I said before, the Commission suggested that privacy should not trump a victim's safety. So information that comes through the SIP, as we call it, is used to assess and manage risk, to help services keep the person in view and hold them accountable, and to keep people safe. So those reports are critical because it might hold information about court and a perpetrator who has attended court. A service may contact the court on the day that that court case has occurred to find out whether that perpetrator is in the community, or whether the outcome of court is that that perpetrator is now in custody. So the importance of that, of course, is that if we know that a perpetrator has been released from custody, we need to manage the risk that he might pose, particularly if he knows the whereabouts of the woman and children. So that information is critical for managing the risk of that perpetrator being released. If we know that that perpetrator has been placed in custody, that changes things as well and means that we're managing a completely different situation. The other part of it is, by looking at the history of a perpetrator, we are able to determine whether there have been multiple victims, multiple intervention orders, multiple periods of incarceration, where there have been other intervention orders in the past. Have they been breached, or has that perpetrator complied with the orders? All of that information helps us to better understand the risk that that person poses and how we need to manage that risk.
And I think Sakina's going to talk from the Orange Door perspective how useful these SIP reports are in managing the risk and the safety for women. So we've come to a spot where we'll have a stop and have another chat around information sharing, because for us, information sharing has been a huge game changer, which means, like Olivia said, we're able now to gather the information that we've known. If you look across some of those cases and see, if we had known this and if we had known that, we also know that women, when they're sharing their stories, and the onus was always on the woman to share her story, that sometimes she didn't tell the same story to different people because she forgets who she's told what to. So having a full picture when a woman turns up at a refuge, or having a full picture, is just very, very helpful to have. So, Gendry, we might...
That's very true. The other part, Janine, is around the trauma that victims described at the Royal Commission. They talked about the trauma for them in having to tell their story multiple times. Yep. So just building on what you just said, Janine, there's also the trauma of having to share stories many times. So the capability for services to share that information means that they don't have to share their story and be re-traumatised each time.
Thank you, Janine and Olivia. So what we're asking you to think about and to share with us now please, it would be great to sort of feel and see what happens in other places, is, are you aware or do you have any sort of universal or sharing of information between the agencies that you work with? Or do you find that you have to start all over again every time a person comes to you with understanding their story or their situation? So if we could have some thoughts around that and some experience from the field, that would be fantastic. Maria, do you have anything to share from your end about whether, you know, there is any sort of sharing of information when someone comes into your service, or do you just speak to that person individually and have to regather their story?
I think so far in my experience that this sharing information between other agencies is no, there is no really, but we do like confidentiality, but in terms of sharing information between other agencies, I think I have not come across really coordinated one, but maybe one-to-one, case by case. Yeah, so that would be the things that I will see in my context. Yeah.
Thanks, Maria. Rajai, what about yourself? You have a number of programs there. Do you find that you have either easy sharing, or is it within confidentiality, or do you need to begin from scratch?
Actually, in Thailand, when there is a case of violence, we have what we call a multidisciplinary team. So the social worker of the provincial or district Human Security and Social Development Office is the case manager. So they can share the information among the multidisciplinary team, including the social worker, doctor, if they come into a concern, police, attorney, in case that the case is go to the court, and police. So among these agencies, they will share the information, but not for the outsider because it's confidential.
Oh, thank you for sharing that, Rajai. Shamindini, I was just going to ask if you would like to share, and then also, Willie, you put a question in or a statement, I might bring you in as well. But Shamindini, what about in Sri Lanka? Would you be able to share something of that sharing of information?
Yes, Jenry. Really, I have witnessed many a times when the women come and share their stories, especially when they want to leads a case in the court, and how the women is traumatized in the time of sharing their information, or either sharing their stories. Because actually when they come to when they start the court proceedings, before that, before the case is filed, she has to share the whole story of hers, to have a proper groundings for the case. So at this point, I have noticed either the legal assistant or a person who listened to her, if she's not open-minded, or either if the person is not have the particular understanding about the difficulties that she's going through, what happens, even at that moment she's blamed, and she's not able to share the stories and injustices that is happening to her every day in her life. So what she does, I have witnessed so many times that she just blocked and not able to proceed with her story, and with tears she stopped, because the main thing that she's not understood, and she is not able to proceed. And from that moment itself, she create she have no trust. She can't build a trust regarding this process that she's going to start. In this case, I feel the information sharing, the one-to-one sharing, especially in the legal process, the women is not understood. And from that, there itself, the legal, when the providing legal assistance itself she's misunderstood, and she's not able to express herself.
So the court in the end continues to perpetrate the violence against women by not hearing or understanding their experience.
Correct.
Thank you, Shaminjanai. Thank you for sharing. Zelna, I see you're here from South Africa. I just wonder if there's a glimpse we can capture from you from the South Africa experience, Zelna.
Yes, I'm actually based in Rome presently.
Yes.
But just some experience from when I was in the field on the grassroots. In South Africa, obviously, we have a high rate of domestic violence and violence against women. And it became much stronger in the fore during the COVID pandemic last year, especially, which caused the government to really put in some strategies in place, which they're still working on to actually implement. But the women on the ground are quite to the fore to be able to push the government to help with these implementations. But the issue around keeping the children and the women safe and having safe spaces for them is still a challenge. I know our police force do have a special task team in each police station. They try to have where there's a special space for the women when they come in with a case to report that there'd be a woman police on duty for her to kind of listen to her story. But the challenge is still there that even if you have the woman police, she's normally alone amongst all the men police, and it's still a challenge for her to be able to be the voice for the women and the children who come in. So yes, the challenge is there as much as they are trying to improve the possibilities. The impact of training on police still has to go a long way.
Thanks, Zelna.
At the moment.
Yeah, thank you for that insight, Zelna. And it's what you're highlighting too is that still the pressure is on the woman. You know, all that she's been through. You know, still the stress and pressure is on that woman to have to again speak and to carry her case forward. Yeah. Before we move on, thank you so much, Zelna. I appreciate that insight from South Africa. Before we go on, I just want to give Willa one chance before we move along. Willa, is there anything you'd like to share? You've been putting some really beautiful things into the chat box. So I just wondered if you wanted to just highlight a couple of points that's meaningful to yourself.
Okay. I think for us, the challenge is that we're working with refugees and migrants, asylum seekers, and most of the times when they go to the police, they don't get any results. And I think as Ziana also said, the training is important because in the training, the police officers are trained to enforce. And this came out from the mouth of the policeman himself that we spoke with, and he said he's not trained to protect victims, he's trained to enforce and catch the criminals. So that's the challenge that we face here, and there's an ongoing need to train the police on the understanding of trauma of victims, on the need for protection. It's not a domestic affair if a person is going to end up in hospital somewhere. So yes, I think we are all continuing to struggle, but it's a good struggle if we can come to a point where changes are made in the country.
And the change needs to be systemic. What we're hearing is we can't just have it. Everyone struggles with little programs here and there that are making a difference, maybe for this one individual, but you come up against a system where if your police force is not trained, or the system needs to change, or the attitudes of people are not being challenged or changed, then you're only going to get a little bit of change in that little local space where that little program is happening, and it's not systemic. So I think that's what we've found is having the authority. So it's the authorising environment by our Victorian government that says that this is not okay, and we're going to address it in every area. Has, I think, made the biggest difference, isn't it? Yeah.
I think our police have come a long way. But as you were speaking, Willa, I was still thinking that if we asked our family violence practitioners, and we have got some coming in at some point, Do police always understand things from the perspective of the victim and the woman? They would probably still say, despite the fact that police have come a very long way and way beyond just focusing on the perpetrator, there are still some who don't understand it beyond the perpetrator either. And we would probably still have we do have examples where victims are still not understood and their trauma is not understood, and why they are not able to make statements to police is clear to us, but not always clear to police.
So can I also make a point from a HAB practitioner perspective? We're actually privileged in so many ways here in Victoria regarding the information sharing, because where all the practitioners are actually they use a trauma-informed practice lens, where we try to eliminate the trauma that they have faced by getting her consent. If she has done a risk assessment very recently with another organization, and part of the MARAM tools that we use, we ask them if they are involved with any other therapeutic practitioners or any services that they are involved. If yes, we get the client's consent to request for that information using our information sharing scheme tools, and clarifying under what legislation we are requiring that information and why, and how it can help the client from repeating herself and getting re-traumatized every single time that she's trying to get support from services.
Very important point.
Sakina.
Yes, wonderful.
Yep.
I just want to share before we go on, I just thank you so much for that insight, and we look forward to hearing more from you, Sakina. I just want to share a comment that's come through from the YouTube, because we want to bring those guys into the conversation as well. So Onali is in Sri Lanka. She says, I work as an educator in the private higher education sector in Sri Lanka. There are many students who suffer domestic violence and violence in intimate relationships in the higher education system. She said, it is unfortunate that private education institutions do not have a framework for providing support, even if the women are courageous enough to open up. The violence they go through, there is no formal way of managing or supporting these students due to the lack of professionals who can provide support and guidance to seek legal support. So, so there's an interesting, another side to the picture about, how we support our students, our young people, in their private personal relationships as well, when it sounds like there's a lack of a recognition within the education system there, and that's a whole other area probably to talk about at some point. Sashi from India says that training the duty bearers on providing a safe space for the children and women is important, supporting their trauma by not traumatizing them further. So she's affirming as well. So that's been a fantastic discussion. Janine and Olivia, are you about ready to hand over to the practitioners, or do you have another
one more thing to go on about the court responses? Yep. So we were talking about courts before, and I think we'll just go into that one, which is, we've got MARAM.
We've got a few more.
We've got a few more, actually.
Okay, all right,
we might
have to move through a little bit.
We'll move through as quickly as we can. So I'll just speak about what's on the slide, maybe, without adding too much more. We did talk about having a multi-agency approach. So organisations coming together and working together, not just to share information, but I think Sakina even mentioned in her brief spot there where she spoke about agencies coming together to share information and to work together, to collaborate. There is a whole framework that sits around this work of not only sharing information, but using the same assessment tools. So going back to what the coroner said, different organisations, different professionals used different ways of assessing risk, different tools. They had a different focus. Some focused on children, some focused on perpetrators, some focused on the women. This model is about bringing all of that together. The information sharing, the tools, the policies, the procedures, so we are all speaking the same language and there is consistency. And this is a requirement. So that's probably the main thing to share. And then the other one is the risk assessment and management panel. We've had a bit of a discussion already about police and the role that police play or don't play. This model brings together specialist family violence services and Victoria Police. So there are 18 panels across Victoria. I co-chair one of those with Victoria Police. And the focus is on, we're going to hear about this, so I won't say much more about it because I know we do have Jade who is going to share a RAMP case to give us a sense of this, but it is about bringing police, corrections, men's services, mental health services, alcohol and other drug services, child protection, housing and other services together for the highest risk cases. So this is about ensuring that we have as much information as possible for the high risk cases, with police really playing a central role in that. The RAMPs were trialled well before the Royal Commission into Family Violence, so they were trialled in 2011, and what came out of the Royal Commission was a request that they be prioritised, so a recommendation that we roll them out quickly because they have in fact been proven to keep high-risk victim survivors safe, and putting that focus on perpetrators and anything that police and corrections and men's services can do to keep them in view and accountable. Yeah.
Okay, so you know, we talked about, we've talked at some, I think some of the people that have contributed have talked about the court system. And the court system for us is a very significant reform. There were a number of reforms in the court system, but they've been transforming their response to family violence to make the courts safer, to ensure that people who they support, they need, get the support that they need in the courts, and that they also keep perpetrators in view. This has been a very significant, so if we asked our practitioners what has been some of the most significant reforms, it is having a family violence specialist court. So the recommendation was that we have that all family violence matters are heard in a specialist family violence court. Someone was talking about the family violence courts and about them not understanding the woman's story. So the feature of this court is that the people, the magistrates, everyone working in that court has a really good understanding of family violence, so that when a woman goes into that court, that they feel comfortable, they feel they are safe, that they have a safe place in which they can be inside the court and not feel like you're sitting in a courtroom where the perpetrator for an intervention order is sitting in the same room as you, intimidated. So these were really significant, having people that really understand family violence, so you don't have to try and, if you're the advocate there with your client, that you're not having to advocate really hard because you think these people don't understand what we're talking about here, and neither does, and the woman feeling like her story is not being listened to. So one of the core elements of the model is power that the courts have and the listings. So they wanted a more consistent approach to the listings of family violence matters and the operational practices that happen in specialist family violence courts. So the listing of all family violence matters are to be heard and determined by specialist family violence courts. So therefore you've got people with experience who understand it. That the listings all related to family violence matters are to be heard together if possible. So instead of having to come back for multiple components of the case, that it was all heard together. And ensuring that the same magistrate presided over the family matters relating to that family as much as practicable. So one family, one magistrate was the principle. And establishing a target to list and cap the maximum listing times to facilitate the provision of a high quality service. So courts would often be pushing people through, but making sure that the matter had time to be able to be heard properly, and ensuring that there was flexibility there, and ensuring that it was a safe place for women to come. So I'll just run through a bit of a case study, so what it would be like to come into a family violence court. So if a victim survivor needs to attend a family violence court and she's got a young child that's got additional needs, the court team, so a team will discuss what needs to be done for this woman to attend this court on this day. And they plan for what that service might look like for her, and they coordinate that. So the victim survivor would arrive at the court, and the court staff would direct her to a safe waiting area, so where she's not likely to be running into the perpetrator. In this case, the victim survivor complimented the facilities because it was not a traditional court. This is not walking into what it is like, what we all think of a court looks like. So that victim survivor and their child used the safe waiting area in a child-friendly space. So a court was made child-friendly to ensure that they had everything that they needed. Throughout the day, the victim survivor had come and go in between those spaces, meeting with the services and everybody that she required to support her, and preparing snacks for her children. The facilities of the court made it a very different experience for the woman and the child who had to attend it. We know that it's daunting. These experiences of going into a court is daunting, and we feel, as it is, there's often always male magistrates who don't understand the story. You don't get where you're coming from. If we haven't done any work on this cultural shift, understanding gender inequality, then we're walking into a court that we feel that no one is going to listen to us and you're not going to get our story. But that has really shifted, and making sure these specialist family violence courts were created. And our practitioners say that this is one of the best things that has occurred in the Royal Commission. So I think, again, we're lucky. It's not perfect. I think, I don't know whether I've got some numbers. I did have it in my notes, but there are 3 of them have been rolled out so far, and 2 more courts are built under construction, because as you can imagine, our old courts were in old buildings that had to either be remodelled or they had to rebuild some of these courts to make them actually safe places for women. 2 more under construction, and there are another 2 planned. So that led us to a question around what is the experience of the court system for women in your country, and how could you improve that?
Thanks, Janine. So I'm going to throw it back to the group that are on with us. Somebody earlier talked about courts. I think it might have been you, Shamindanai, I'm not sure, but somebody has already mentioned courts. And if you have accompanied anyone to court, in this situation, what has been your experience there? Is it user-friendly, or is it something that causes more trauma? What is your experience in the room?
Shamindanai,
yes.
Yeah. Of course, it's really a trauma. Even the first, I would like to say that it's excellent to have this concept or either practice having a family violence court, because they have a separate, I visualize that maybe they have a separate place, like maybe few only enter into the premises. Maybe it's very, where we can have the confidence and all that. And even more, the woman is more confidence in sharing or expressing herself, so that such an environment is created maybe in that court premises. So it's really a nice and it's nice to hear these practices are happening in the world. And of course, it's really very painful experience. Even when we go for a divorce, even a woman, even I'm talking about Sri Lankan women, they just don't take a step for go for a divorce. She has a process, she try her best to be with the family. So the last moment only she decides, okay, either I need to go for a separation or either I have to go for a divorce. So at that point, to come to a court, we see the magistrate and the court, the lower divisional courts, it's crowded like anything. and this woman has to share all her privacy, like no, in front of every one of the other people, and it's like a drama. Like no, we are listening to the whole story about her family life and her whole life story. So it's really painful, and it's really a trauma for a woman to come to a court and to get, like no, seeking for justice. It's hard, and even not every woman can stand with this, I feel, because only a woman has a strong like no willpower, or either like no, if a woman is very strong and steady, only she can face this scenario. If not, it's impossible to go through. It's really a trauma, I would say. So in Sri Lanka, I know there's no possibility like that, or either good like no environment for a woman to go for a court. It's really a pathetic situation. Thank you.
So less likely to actually do anything if they think they have to go to court and be put through that because they can't do it.
It just occurred, yes, thanks, Jeanette. It just hit me, Shimon, that idea that you just clearly showed us, where I just got a picture of this woman and this court filled with people and her spilling her story. I mean, the shame of it, the courage it would take, and just to have that exposed, not just to one person, but to a whole room full, must be a very, very, very difficult thing to do. Yes, thank you for sharing that story. It's a great insight into what people are experiencing in other countries. Anyone else have a story or a similar experience to Shamindanai?
Sorry, Jandri, I've got a different story, a different view that I would like to share. We do also have...
Yes, Sakina.
Can you hear me?
Yes, can hear.
Yep. We also have got the court network here in Victoria. You know, if a woman is going to a court hearing, whether it's a family law or it's a magistrate's court for intervention order, they can call, or a support worker or a practitioner can advocate for the woman to book a safe room and to discuss with those court network or family worker at the court, to advocate for her, to, like, you know, take her throughout the court, be with her at the court hearing, and complete a safety planning if she's a high-risk client, and, like, you know, make referrals on the day for the client to make the journey very smooth for the client, especially if there is children involved. I think there's a lot of great supports here in our court systems for women trying to come into this.
I was going to add, Sakina, that I know during COVID, video link was used because clearly we couldn't go into court anymore, and that practice has continued. So I think there were great benefits for women in being able to connect to the court case via video link, and not having to go in, particularly where some of those courts were not family violence specialist courts. And that practice has continued. So I know that the Orange Door has been a place that women have been able to come to, and their video link court case has been arranged with support in the Orange Door.
Yes.
Fantastic. Yes, that's been a great new way of doing things. Sharani, you've put in quite an interesting experience in the chat box as well. Do you want to share with us your thoughts, Sharini?
Yeah, Jandri is really traumatized, victimized, the same woman who is going to court, because there's a huge queue. Every time you go, due to so many reasons, they have to come back home. They say today they didn't hear my court case due to so many reasons. So it's dragging years and years. Is getting a divorce is a difficult thing in Sri Lanka. So they might not go for a court case and suffer and stay hidden. Thank you.
Thanks, Sharani. And Will is saying in Malaysia the same thing. The courts are so overloaded that, you know, you might go for a whole day and still not be heard and have to come back, and it may take a long time. India, from Sashi, this is great. We are sharing our experiences. where we have things in common that are things that we need to challenge and overcome. Thank you all so much.
That's the end there, Gentry. So I'm just wondering, if there's any other questions that people have on anything that we've talked about, but also I've put the website up there for the Family Violence Royal Commission, the recommendations, and the 29 areas that I've talked about. You can literally click into that area of reform and it will tell you where we're up to in the reform piece. It will tell you what we've done, where we're up to and what we're doing now, and what has been implemented from the very beginning of the Royal Commission. So it's actually really easy to interact with website and can talk more about, but happy to answer anyone's questions around what we've spoken about today.
Why don't you just unshare for this while people are thinking, just unshare and we'll come into the main room and we'll make a shift from one thing to the other. So I'm hearing some thank yous in the chat room. So I just want to think what we might do is if there's anyone with a question, just maybe put your hand up or unmute if you have a question, one more question. Or yes, Shamindanai.
Yes, Jenny, I would like to ask this regarding these family violence codes. Are they accept all kind of cases there, or do they have a particular kind of cases or any matter related to family? They would be able to accept. And the other thing is, what is the procedure, or either maybe the how they are step by step how they get into the filing the case or something, how they practice it. Thank you.
The family violence courts are specifically for family violence matters, so the matter has to be listed as a family violence matter, and the Royal Commission said if it's listed as a family violence matter, then it should be heard in a specialist court where it will have the right people with the right training who understand the situation. And of course, because we're only in the middle of implementing this, we don't have, and obviously, in Victoria, we have jurisdiction areas. So if you're in an area where there is no specialist family violence court, you will go through the normal court process. But in all, that where they want to get to is that there will be family violence courts, so that every matter that is listed as a family violence matter will be heard in that court. And I didn't get, did you get the second part of Shamindai's question?
Just to explain about the process, how the women come to the courts and how the proceeding starts there.
Probably got one of our practitioners around who's been to court. Do we have any of our practitioners on there who've actually been into the, I have been a long time ago, but
the family violence
specialist courts.
Cassie.
Yeah.
Cassie.
So I'm a family violence practitioner. I actually work with police, so I'll talk about my role a bit later on. So the process is any family violence matters means it's a criminal. So police bring those matters because it means they've breached the intervention order. That's what makes it a family violence matter then. So police take it to court, and so they prepare all the evidence in the file and take it to court, and they basically act on the woman's behalf and charge the perpetrator. So so they take it to court, they submit the application of these are the charges, this is the evidence we have, and then it starts a process of whether the other side, the perpetrator, wants to plead guilty and say, yes, I did that. Most of the time they deny it, and it's a long battle of what more evidence do they need, or are they going to contest it? So they're going to say, no, I didn't do that. That's where then police might need to bring the witnesses, and that's when the woman then might need to go to court and give evidence. So then and then the magistrate makes a final decision based on the evidence provided by both parties to the outcome. So it can be lengthy. A lot depends on the other party, the perpetrator, and if they're going to drag it out and be difficult. But that's a process in a quick summary.
You would also see, Cassie, that the actual environment in which the court is set up is very different from our traditional courts.
Yeah, we had a conversation about that. That might come up in Cassie's chat. I think just to, we've been listening to, thank you to Janine and Livia, who have really opened up and really talked a lot about the systemic changes that have happened. What we're going to do now is actually have 3 presentations on showcasing some of the actual work that has come out of the Commission. This is really important work, because what you'll see in the next presentations is the application of the Royal Commission and how it impacts on the lives of women and girls. But before we do, let's give a virtual clap to Janine and Livia for their part. It's been really fantastic. And I'm going to introduce you to 3 of our wonderful practitioners. Cassie Langerak, who just spoke to you then, who is a senior practitioner in the family violence area. And I think she's going to share a little bit about the what's called the Alexis response model. We have Sakina, who you've heard from as well, Sakina Hassani, who's an intake and an assessment practitioner, and she'll share more about the Orange Door partnership model. And Jade has joined us as well, and she's a senior case manager, and she'll talk about some frameworks to support women and also a bit about the RAMP model, I believe. So please stay on, because this is really where the action is. This is where we see how on the ground these responses come to fruition. So I'm not sure who's going to speak first there. We're going to go to Cassie first, is that right?
I think we go to Sakina first, actually.
Sakina first. Okay. Thank you, Sakina. Really looking forward to hearing from you. Thank you.
Greetings. It is my honor to speak with you about my work at the Orange Door, which is devoted to interrupting the cycles of violence inflicted upon women, children, the elderly, from all backgrounds, natives and immigrants, including women and children from culturally and linguistically diverse backgrounds, Aboriginal people and Torres Strait Islanders, and members of our LGBTIQ community. The Orange Door also reaches out to the men who act as agents of violence. I am an Australian citizen born in Afghanistan, raised in Afghanistan and Pakistan, who arrived here in 2009. Since finishing my master's degree in human rights law, I have been working in the family violence sector for over 4 years now. I currently serve as a family violence practitioner at the Orange Door. As the Sufi mystic Idris Shah, whose family was actually originally from Afghanistan, uses a short narrative handed down across generations by the Sufis to illustrate the necessity of seeing reality as multidimensional. 20 men encounter an elephant for the first time in the dark. Each person touches only one part of the elephant. Thinks he has the full picture, an elephant like a tree. Says the man touching the leg. No, it is a water spout. Says the man touching the trunk. More like a fan, claims the man touching the ear. A brush, says the man touching the tail. No, you're all wrong. Elephant is like a plow. Proclaims the man touching the tusk. However, the Sufi Idris Shah says, without a multidimensional vision of reality, we see only in part and can therefore only make a partial response to the elephant in the room. A woman who walks through the Orange Door is often caring for children. She often has a job. Violence threatens her housing. She might become homeless. Violence threatens her work. She might lose her job. Violence threatens her children's well-being, their academic performance, and emotional development is impaired. In addition to these material, financial, and familial vulnerabilities, the woman carries the physical brutality of violence in her body and memory, and the emotional scarring of trauma in her psyche for years after the cycles of violence against her are interrupted, and is often in need of medical attention and psychological counseling. The Orange Door recognizes that people who suffer violence in the family are multi-dimensional human beings with multidimensional needs. Since a person's needs are multidimensional, we at the Orange Door offer a multidimensional response. First, we work in teams composed of practitioners from multiple disciplines, which address the multiple needs of women and children at risk through a trauma-informed lens. Our team members are from different government agencies and community services, such as Aboriginal services, the Department of Health and Human Services, childcare agencies, therapeutic intervention providers for victims of family violence, and also sexual assault. So the referral pathways are different. With over 100 staff practitioners, the Orange Door is designed to provide a coordinated way of support to the victim survivors of family violence or those who are actually at risk of family violence. There are several ways of engaging with our service, such as self-referral, community referrals, professional referrals, and child protection referrals. However, the main referral point is the L17 reports from the Victorian Police Portal. And we have got process in place. Once the referral is received by the team from the above or the entry points that I just mentioned, it will be triaged through the active response team, it's called ART team, to complete the screening and progress the screening to cases. Practitioners then complete service history check on each case and consult with various teams, including the community-based child protection, Aboriginal and Torres Strait Islander practice lead, child wellbeing team, advanced practice lead, and other relevant services which may have been involved with the family recently. Then the team leader in the triage team must rate the level of risk based on the history of family violence and the service involvement through various services. Following the consultations, the case will actually then proceed to assigning team leader. The team leader will assign the case to a practitioner to make a safety call, do intake and assessment, and plan according to her or his needs. In addition, the Orange Door provides an immediate response for people in crisis during business hours by linking them to specialist services, including referral to women's refuge to go into hiding if they're really high risk, medical treatment and care, accommodation, and practical assistance. The Orange Door practitioners provide specialist support and tailored advice for victim survivors, families, professionals, and children, with a strong focus on perpetrators' accountability based on the best available information and the latest level of risk or the risk assessment tools that has been used. All the teams and team members within, work within a shared framework called the Multi-Agency Risk Assessment and Management Framework, which was explained by Janine and Livia in detail. We share a common understanding of what defines family violence, that it is a pattern of behaviors that includes coercion, control, and domination of others within the context of a relationship. This pattern can include physical and sexual violence. This pattern encompasses a spectrum from verbal abuse to extreme violence that can result in a permanent injury or death. And then the team members have access to vital information that comes from the police, from the courts, from the correctional system, child protection branches of the government, through what we call SIP, which was explained again by Janine and Livia, the central information point, which opens the information silos that in the past have been kept. This information has been kept concentrated and isolated. Not only do we gain access to this information through the SIP request, but we also share information between team members to create a holistic picture of the person or persons who come through the Orange Door. In the meantime, the clock is ticking, and for women facing family violence in the family, the clock is often connected to a time bomb. Time is limited and information is crucial for the protection and safety of children and women. Today, when a woman calls or walks through the orange door and enters the client services office or officer and says to us, I need help, I do not want to go back home, I do not feel safe to go home, a team leader checks our system, CRM, to find out if we have had previous engagement with this person or client. Does she have a history, or is there her first time seeking help from the orange door? The team leader comes to me or any other practitioner with the available information. Then I would, if it's me, I would read the file, the history, if any. Are there children? If so, how many? What ages? Do they have specific needs? Do any of the children suffer any disabilities? After I complete my review of the available information, I then actually go and meet the client. I complete TREM or risk assessment using the MARAM tools and determine what is available through the organization for this client. If she is at risk and needs immediate protection, we offer her emergency accommodation. We book her, and if there is any children, the children in a safe and secure hotel, and the worker will work with her throughout the exit plan. I also retrieve the perpetrator's file and then attempt to check if there has been an open case recently with the orange door through our men's team. And if yes, I would then consult with his practitioner, who will attempt to acquire more information and to plan his participation in services that includes, like, therapeutic services, men's behavior change programs, alcohol and other drug services, and any other relevant services which have been involved with the family recently. And if there is no history or open case with the orange door, we contact the local police. We check the L17 portal for police reports, and we determine that he is in need of intervention order from the courts. And if there are any children involved, we will contact the community-based child protection to get more information and provide a child-centered response to the family's need to ensure everyone is safe and included and heard, and they are part of our safety plan, part of our work. We support everyone, and that includes who are at lower risk by calling upon external services if they need, and that includes counseling, housing, or any services that they need, and they are not in immediate danger. So while there are general characteristics amongst the variety of people who walks through the orange door, in my experience as a family violence practitioner, I think every person is different and has got different needs. To illustrate, I would like to share with you the experience of a woman I will refer to as SR. She is originally from Sri Lankan background and lived with an abusive husband for over 30 years until she decided to leave him in January 2021. SR endured almost the full spectrum of violence for 3 decades: verbal abuse, emotional abuse, physical abuse, sexual abuse, and financial abuse. She moved out of her home with the assistance of her 2 adult daughters, moved into a rented and secure private accommodation without any furniture. She lived there for 2 weeks before she called into the orange door because a friend suggested that she can call the orange door and get support, and that was the self-referral. I answered her phone in February 2021. SR was deeply ashamed to ask for help or support since she did not have a single dollar on her name. And, in some of the cultures, you don't ask for help much, especially if you're a woman. And this woman was pretty vulnerable because the husband had withdrawn 123,000 from their joint account just the day before. I reassured her that the orange door was here to help her and discuss the different options available for her. SR continued to be harassed by her husband, who came to her workplace demanding her signature to open a new bank account. I encouraged her to apply for a family violence intervention order, which the court granted her on the 25th of February which interrupted the husband's pattern of stalking and harassing her. I consulted with the team leader to obtain 5,000 through brokerage for SR to purchase her furniture and obtain a $500 voucher for groceries. Her furniture was included a bed, mattress, dining table, 2 chairs and sofa, which arrived on 13th of March. In addition to those material, food and other support, we provided SR with ongoing emotional support, provided her with a case manager from her country of origin, connected her to legal services to facilitate divorce settlement, connected her to 1-800-RESPECT counseling line, and continued to plan for her ongoing safety. On Friday, 14th of March, when I called her and let her know that I was closing her case with the Orange Door since her multiple needs had been met, SR told me that when her divorce settlement is concluded, she would like to donate between $5,000 to $6,000 to the Orange Door. On that note, the Orange Door does not accept any monetary donations from any client because we are government funded. However, she has agreed with the Orange Door to use her story for such events. This is what she said to me. I'm sure that my money will be used for a great cause, which may be of help to another woman who is in a similar situation as me. I was desperately waiting to talk to you because you make me calm, and I will miss talking to you and checking on how I am doing every day. And if I had not called the Orange Door and not spoken to you, Sakina, which was referring me, or received this great support, I would not have been able to stand on my own feet and perhaps would have stayed in the abusive relationship, which might have ended in my death.
I think Sakina may have frozen, Teresa.
Looks like it, Gendry.
Yeah. Okay. Janine, can you tell how much more there was in her presentation? It was an interesting point that which she stopped on. Some questions. Okay.
So it was Sakina, really about asking questions now, Gendry.
Okay.
And if she gets back in, or we can save it till later.
I think we'll save it and see if she comes back in, because I think it'd be great for her to be part of it. So we might do all the questions at the end. I'm sure that was a very powerful presentation from Sakina, and she did end on a very powerful note in that way. So we'll just save all the questions till later, and we'll just cross fingers that Sakina.
She's back.
Can you hear me?
Okay, yes. Sakina, we lost you, Sakina, just when you spoke about the SR was afraid that if she hadn't spoken to you, she may have lost her life. That was the last we heard.
Sorry, I couldn't hear. Gendry?
The last bit we heard from you was when you were sharing about SR saying that if she hadn't been able to connect with you, she may have stayed and lost her life. That was the last words we heard.
Thank you. I'm very grateful to be part of a team at the Orange Door, which is interrupting the cycles of violence and creating a safer community for us all. In conclusion, I would like to share my personal hope with you and everyone who walks through the Orange Door. I was born on Nowruz, which is the most important holiday in Afghanistan, Iran, and some other Middle Eastern countries, and one of the world's oldest that can be traced back 5,000 years ago. Nowruz falls on the spring equinox in the Northern Hemisphere on 21st of March. Nowruz means new day, a moment of new beginning. My hope for every person who walks through the Orange Door is for the blessing of a new beginning. That brand new day begins whenever a woman or man, young or old, children, immigrant or native, parent or child, can say, just because you love me does not give you the right to abuse me. Thank you.
Thank you so much, Sakina, for that very powerful and moving story of SR, but also of the work you do in the Orange Door. And I don't know if you saw it, but some of your colleagues are listening, and they said, we are so proud of you, Sakina, from us here at the Orange Door. So you have some friends from your work listening, and they're
So
encouraging you.
Sakina.
Thank you.
I think that we might just come out of the, we'll leave that, it's okay, we'll leave the PowerPoint up because we're moving along. But just, Sakina, are you happy to are you able to hang with us? Are you able to stay with us? Because we might hear the other one and then we might have questions at the end. Is that all right?
Yes, yes, yes.
Perfect. Thank you so much. It was a beautiful sharing. Jade, would you like to share your part now?
I was on mute there. Hi, my name's Jade. I'm a family violence case manager in the Good Shepherd Family Violence Case Management team down in Mornington. I'm going to be talking about the Risk Assessment and Management Panel. I've had, over the course of sort of 3 years of working for Good Shepherd, I've had a few cases that have been discussed at RAMP. So I'll just give a bit of an overview. So RAMP is a multi-agency group meeting. It takes place once a month. There's key agencies that are involved in that from the community, which Livia mentioned earlier and are listed there. There's also a coordinator and 2 chairs. One of the chairs is from the police, and the other chair is actually Livia, who's here. And the purpose of it is to come together, really the aim is to come together and share information about women and children who are at the highest and most significant risk of harm from family violence. The RAMP was rolled out statewide following the Royal Commission into Family Violence in 2016. And I'll just read out quickly what the previous health minister said about that rollout of RAMP. She said that RAMP saves lives. When agencies come together to share vital information, women and children at serious risk of family violence do not fall through the cracks. That's why we are rolling them out across the state. And the principles of RAMP are there, and one of the key principles is really holding perpetrators to account and reducing harm to women and children. I'll move on now to talking about a client that I'll refer to as Mandy, who had a journey through RAMP. So in terms of the background, Mandy was in a relationship with the perpetrator for around 12 years. He was her husband. They had 2 children together. During the relationship, the perpetrator was controlling, emotionally abusive, and at times the abuse escalated to physical. He had a diagnosis of BPD and depression. The relationship came to an end when he left her for another woman. And at that point, Mandy described feeling quite relieved about that relationship coming to an end. And initially, things were quite amicable. The new relationship, however, was quite short-lived, and the abuse towards Mandy escalated when she refused to reconcile with him. So there was a deterioration in the perpetrator's mental health, and he began to threaten to commit suicide. There was an incident where he came to her home, the family home, to collect his belongings. He noticed that the wedding photos were down, and he became very angry, threatening to burn the photos. He started damaging property, kicking the door, smashed the window, and threatened to burn the house down. The children were all present when this happened and were described by the police as being terrified. Mandy later received messages from him saying this isn't the worst that she's seen yet, there's more to come. And again, said that he felt like burning the house down with her in it. Following that incident, the police sought an intervention order. Can everyone still hear me? Because I can hear a bit of like the line went a bit funny there.
Yes, we can hear you. Go for it, Jade.
That's fine. So following that incident, the police sought an IVO, and that was all granted and implemented. Following the IVO being in place, the perpetrator persistently breached the IVO. He was stalking Mandy, and he at one point tried to run her off the road in his car. This resulted in him being incarcerated for a period of time. At this point, given all these concerns about family violence and escalation, the police referred Mandy to the Orange Door, and Orange Door referred Mandy to us for ongoing case management support. So at this point, he was released following his period in incarceration, and the violence continued to escalate on his release. There was family law court happening, which was a real trigger. Following a family law court hearing, he was not permitted any contact with his children, and days later he attempted suicide and was sectioned under the Mental Health Act. He also applied for a cross IVO, which he used to abuse Mandy. He would seek any sort of information to make it look that she had tried to breach an IVO and abuse him. So due to the ongoing escalation, I had a consult with the RAMP coordinator, and that was really because of the evidence-based risk factors, because we know that these risk factors are present, and from research were present when women were seriously harmed or killed, or children were also seriously harmed and killed. So around this, the RAMP referral was accepted, and in the early stages of the RAMP meetings happening, there was ongoing breaches of the IVO, and the perpetrator started following Mandy whilst she was taking the children to school, and he also wrote graffiti on the wall of her fence to intimidate her. So I'll just now talk about the impact that I think RAMP had. So I'd say what was helpful was that there was timely information sharing about the perpetrator's mental health. So health and mental health services shared information with family violence services about his presentations and admissions to hospital, which was really helpful, which allowed me to make Mandy aware and safety plan with her. There was also timely information sharing from corrections, who the perpetrator had a corrections order about risk and engagement. So if the corrections case manager had concerns during sessions about any risk to Mandy, whether that had been something that the perpetrator had said that would, or his presentation that would indicate that he was an increased risk to Mandy, that was shared quite quickly. And safety planning occurred with Mandy following that, and making Mandy aware of that. There was quite a proactive police response to hold the perpetrator to account. So the police patrolled the school run and were able to catch him breaching the IVO. And this resulted in a further period of incarceration for the perpetrator. And on his release, he had very strict bail conditions, one of which was excluding him from the local area. We completed a flexible support package, which a flexible support package is a pot of funding that we can apply for women and children experiencing family violence to help with improve their safety and their recovery from violence. So that FSPs are actually are fast tracked if a client, if the client is open at ramp. So CCTV was funded following that flexible support package, and that was able to actually evidence IVO breaches. There was also collaboration between the Family Violence Unit and the local station, which was really helpful, because when the perpetrator was reporting cross IVO breaches, it allowed the Family Violence Unit to debrief the local station and let them know that actually that Mandy was a victim of family violence. And then there was also collaboration as well, which was helpful between myself and the Good Shepherd counsellor. I was sharing a lot of information with Mandy and doing a lot of safety planning with her around the concerns about where the perpetrator was at and his behaviours. So it was quite helpful for me to share that with the counsellor, so that the counsellor could then come in afterwards and debrief with Mandy and provide some emotional support. So we worked quite closely together. There was also collaboration with child protection around the risks to the children. So the child protection practitioner was actually a family violence specialist practitioner, and she was completing the report for Family Law Court. So we had care team meetings so that she could get the full picture of the concerns. There was also safety planning with the school as well, and because the school were aware of this family violence and the impacts, they were able to waive school fees because there was a lot of financial abuse happening as well, and they supported the Mandy with material aid as well, and were really vigilant in terms of safety planning. So following, as RAMP sort of progressed and towards the end, I'd say that there was a reduction in persistent and significant abuse. It certainly wasn't a perfect situation, and there was still at times trigger points and escalations in abuse. However, what the perpetrator's case manager concluded about the de-escalation was that the perpetrator potentially realised that he was not gaining a lot from his behaviour, and that the consequences were outweighing what he was gaining, because he certainly wasn't having contact with his children. Things weren't looking good at Family Law Court for him. So although there might not have been any sort of dramatic change in his insight or meaningful change, he seemed to be deterred by the consequences, and certainly Mandy was confident in reporting breaches and any concerns. And I think I would say that Mandy was probably quite empowered by the whole process. She often spoke about feeling supported by the services that she was involved with, and particularly police as well. She was able to reflect a lot on the relationship, and she spoke about how she used to make excuses for his behaviour and around his mental health, but she sort of gained more insight into his power and control tactics, and she was able to focus more on herself and the children. And I got this email from the Good Shepherd counsellor, because when Mandy closed with us with case management, she continued to be supported by the Good Shepherd counsellor. So recently, the Good Shepherd counsellor contacted me to just let me know about the outcome really with Mandy and where she was at, and she sent this email. So she said, I just wanted to let you know that Mandy has started her dream job as a stable hand and is beyond happy. As you know, her love of horses has been a huge part of her healing and reducing fear of the perpetrator. If we look at the comprehensive Good Shepherd wraparound recovery journey she has received from Good Shepherd, she started at the point of extreme fear, and She said, you and the family violence team worked with her to build safety around herself and the children, and family violence counselling provided therapeutic counselling to help her heal and recover from the emotional trauma and manage her anxiety and heal from the violence, to move forward and strengthen her parenting capacity to help her children also recover. She is exiting our service as an empowered woman. Children are happy and doing well. She is well on the way to achieving her goal of full psychological and financial independence. So I'll end there.
Thank you, Jade. Once again, thank you for taking us deeper into the journey of Mandy, but also the idea of what the RAMP, that partnership model, can provide women. It's a really great example of how when we work together, we can get the best outcomes. So if you've got any questions, please make a note, write it down, and we'll collect all the questions and then have a conversation at the end. But we'll move on to Cassie Langerak now. And as I said before, Cassie's going to speak about another model that we use to support women. Thanks, Cassie.
Thanks, Gendry. So I'm Cassie. So I've been with Good Shepherd for 3 years, and in this particular role for 2 years as the Alexis worker. So the Alexis program, it's a family violence practitioner embedded within the family violence unit. So it's a specialist police force. So they're called detectives, and they do extra training in family violence, and we work with high risk women and children of family violence as well as the perpetrators. So originally the model focused on recidivism, so repeat women and perpetrators who kept having multiple family violence incidents within a year. But that shifted at the time I joined in 2019, focusing more on high risk incidents that were more serious and that required more proactive police investigation and more charges to hold the perpetrator accountable. And a lot of the times they were sentenced to significant time in prison. So my role was to work alongside them together and provide a more of a holistic response to women who often had more barriers to engaging with the mainstream services such as Orange Door. So that the barriers included whether it's their mental health, their physical health, they're facing chronic health issues, disability, alcohol and drug substances misuse, child protection history. So any barriers that made it hard for them to trust police and start that initial engagement with services. My role was to do that more joint assertive outreach with police, where I go out with them and I go to the hospital or the home or wherever she might be and provide that face-to-face meeting and just slowly build that rapport, because often we find that there's often a window of opportunity when that incident has happened, whether it was an assault or whatever happened and police were notified. Often it's that 3 to 5 window. If you don't call or try and engage, they move on and they say, things are fine, I'm okay, I don't want any more support. So being in my role, working directly with police, I get information a lot quicker. And because they're police, they receive information on the go really quickly. So it's very dynamic, and any day can change where they might go, oh, we've got a woman in the hospital, an incident has just happened, Cass, can you come with us? So I'll go with them to the hospital, and basically they explain their role as police and the charges and the criminal aspect, and my role is to focus basically on the rest, her emotional and social well-being and her safety. And so often I find that face-to-face is really crucial, because I guess 55% is in our body language of building rapport. So you take that away and just do a phone call. That's a lot harder to build rapport, still doable, but for women that have got multiple barriers or had poor police experience, and as we all know, there are lots of times where we have had in the past and still current poor police responses, and women don't feel safe and they don't feel like they can trust police. So having my role, I kind of become that middle person in between the detectives and them, and just slowly building that relationship, and then hopefully they're interested in ongoing support, and I provide that ongoing case management, more longer term support. So the focus is to reduce ongoing incidents and ensure these women and children are supported that have multiple complexities or barriers that wouldn't go through the mainstream channel or portal. So I've got, I guess, a case study that reflects, I guess, how this model works really, really well. It was one of my cases when I first started, and yeah, really, it was a good outcome in the end, and it's one that's really stayed with me. So this one, her name was Macy, and she was in her 80s. She was a very sweet woman, and the dynamics was of family violence was between her and her son. So it was an elderly abuse case. And so this was the first family violence incident actually reported to police. So what had, so her son was in his 60s, and he was financially reliant on Macy at the time, also had mental health, and there was a deterioration. He wasn't taking his medication, so they were acting as exacerbators to the situation. So what happened is the incident that got police involved was Macy, her story was that she heard a noise and her son was at the door, and her son, the perpetrator, thought she was an intruder and has gone to attack her and strangled her, and there's been a bit of a tumble. And so due to that, Macy has run to her neighbour to get support, and she went to hospital. But in that time, the perpetrator, her son, has also self-harmed himself quite significantly, and he's had to go to hospital as well, another hospital. So then police, Somerville, were notified, and I got on board because she discharged herself from the hospital back home. So we were able to meet her at the home, and I was able to introduce myself and explain who I was, and just have a chat just with her and see how she was going. So in the end, it ended up being quite a big day because police had to come to the house and make it a crime scene because there were certain things that they had to gather from the home as a result of the incident. So my role then was really crucial in just providing her the emotional support, chatting with her, keeping her a little bit distracted from what police were doing. It was quite a long night, and often we know it's so overwhelming when the incident has happened and that's traumatic and horrific already, then to deal with police, and you've got like 5-10 police officers in the house, and you know, she's, you know, been living on her own for a while, and then with her son, and she has very limited support. So that whole process is really overwhelming. So I guess the benefit of the Alexis model is that I'm journeying with her at the current of what is happening in the police journey and their investigation. I can be there with her too. So as a result, she was quite happy for me to stay supporting her. And that meant following up with medical appointments. So because of the strangulation, police wanted her to see their doctor to get more evidence. So I was able to sit in the car with her and take her to the hospital, and she was quite nervous. So she was holding my hand, and we got to sit in the hospital and wait. And then she saw a doctor, and she was happy for me to sit in with her in the doctor's appointment. And I guess I think about the woman's journey is that they've, you know, spoken to police, different hospital workers, another doctor, and just trying to get their head around everything. And I guess we know trauma impacts the memory and our collection. So, and often police want all of the evidence quickly. So it's a lot of pressure to, you know, go to the doctors, get this checked. But it's like what she's gone through and what we know about trauma is so overwhelming. We ask so much of them. And so I guess the role of the Alexis is really beneficial because it provides that extra support, because often we know women are isolated by the perpetrator. So they have lack of friends and family. So they don't have people that they're comfortable to take to them, to these hospital appointments and that. So that was the start of her journey. So in the meantime, though, the perpetrator's son ended up taken to hospital, but due to his mental health and health issues, he was actually kept in a specific hospital instead of in custody. So then part of the process there was figuring out her wishes and her safety and what she wanted. So police had taken out a full IVO exclusion, IVO meaning that they could have no contact, no communication, couldn't see each other at all, and he couldn't commit family violence. So the struggle here and the challenge we faced was that it was a mother-son relationship. So it's very hard to sever that biological, that emotional bond and just say, you know, never seeing him again. She had her own illness that she didn't want to talk about, but she was dying as well. And she didn't want to not ever see her son again. And so it was that balance of her physical safety is paramount, but as a holistic being, if we look at a human being, there's her emotional, psychological, mental well-being. And she was threatening that she wouldn't eat, that she'd kill herself if she couldn't see her son. So then my part of the role was sharing information to this hospital, to the social workers and the doctors there about what things could we put in place to reduce risk so that police might be supportive if we vary the IVO to a limited order to the fact that he can't commit family violence. And my suggestion was that they see each other only in the community where it's a public setting. So through the family violence information sharing scheme, I could inform the hospital that, you know, he needed his own money and income that would help release pressure of him relying on his mum, Macy. Also that he needed medical, you know, getting linked back into mental health services and potentially his own house instead of being dependent on his mother, to kind of put in some risk factors to help reduce risk. So through that information sharing, I was able to work with the hospital quite well. And then I was able to talk with police and go, this is what we're doing. This is what Macy's wishes are. And so then we eventually got to the court for the IVO hearing. And I was able to support her, talking to the lawyers about what her wishes were and respecting her autonomy and what she wanted, taking into account that she didn't have much years left to live and this was her only son. And she still wanted to have a relationship. So it was, how can we balance it in a safe way? So by all that information sharing through the hospital, they were able to get him access to income, his own housing, and he was happy where he was placed. And then we were able to get that IVO varied to a limited order, which meant they could see each other in the community and have lunch, but still she could go to her own home and keep safe and have her own space, and he could have his own space. So that was a really good outcome. It took about 6 months of me working and supporting her. Another crucial step, I guess, of my role was why the Alexis role worked so well is she didn't know how to use a mobile phone. So if her incident report went through the mainstream services, no one would have been able to contact her, and it would likely have probably closed because there was no way of getting her a phone in back then. So through my role, I was able to go with police and figure out you don't have a phone. And so it took multiple visits for me to teach her how to use a mobile phone. So that, I guess, of my role being practical, I could, really teach her. And every time I'd come to her house, we'd do a test ring. I'd sit in one corner and she'd sit in one corner and teach her how to swipe the phone and use that as part of her safety. So that was another thing that was quite beneficial from the Alexis role, that being able to directly go out and see her and see her in her home where she was comfortable rather than getting her to come to me is a benefit of, I think of the Alexis role. So she was, we developed a really good relationship, and I was able to get her linked in with some other services for her health and just keep her updated in that whole process, because I guess a lot of the time police tell you, but then they don't kind of reiterate or take that time to explain what's happening next. So by having me there, I could really explain and be that kind of mediator between her and police and go, this is her wishes, how can we manage this in a way that gives her safety, but also takes into account the rest of her. So that was the story of Macy and her son, the perpetrator. So that was a good outcome. I guess we know that there's a lot of complexities and not every time is the ideal outcome, but this case has really stuck to me and how the Alexis role really worked well.
Thank you, Cassie. That's a fantastic example as well. So we've just heard, what we might do is, if you could stop sharing, Janine, while I chat for a second. What we've just heard here is 3 ways that on the ground we can help people. We've heard about the orange door and how we work with multiple teams and multiple organisations. We've talked about the ramp model, again, where we're linking in with police and others to make sure the best outcomes happen. And then the Alexis model that Cassie just spoke about now. Fabulous programs. And, you know, it's sort of, I think what we're talking about here is having multiple inputs along the journey of the woman. So there's a journey and not one bit actually fulfills the whole journey. We need to have these interventions at different parts. So I just invite you for a final opportunity. I want to refer to something that Shirani put into the chat box as well. But before we do that, is there any final questions, comments, reflections that anyone would like to share? Just unmute and please share with the group. Any final reflection, feedback, a question, anything at all? I'm getting lots of thank yous in the chat box. I'm sure you're seeing that. I hope the team is seeing all the thank yous. I can hear somebody there. Please come forward.
Yes, Gendry, I would like to
just start.
Yeah.
Yes, thank you.
As a question from Cassie, because they are having more experience regarding working with the women. And even here in Sri Lanka, what we feel like she raised that the emotional bond. Like, you know, the most of the time the perpetrators are the family members.
Yes.
So when it comes to like this emotional bond, it's really a matter a lot. And when a woman comes after an incident, the decisions that she takes, and after some times, the decisions that she takes is totally different. Maybe she she changed time to time what she's going to do with the problem. In that case, Cassie, how do you feel that how you help the person to realize, or either how you handle those emotional bond situations, and how you go through with those difficulties, because it's very common as we work with the women. Yeah, thank you.
Definitely. As we see that often people go, why don't they leave? But there are so many myths around family violence. There's so much more that people don't see of why they stay, and that emotional bond is huge. And I guess for me, working with women is working really in their pace, but kind of slowly encouraging and informing them of, I guess, how they should be, I guess, treated and valued, instilling, I guess, the values that they've lost, that they don't think they're worthy, that they're worthless, that they're ugly, that they're pathetic. So rebuilding that self-esteem and that confidence back in them, that yes, you might still love him, but he can't treat you this way. That's not okay, and it's not a good example. No one should be treated like that. So doing kind of those reaffirming statements of what is healthy and what's unhealthy, what's toxic and what's not. I guess unpacking what love is and what a healthy relationship is, because often different cultures, different upbringings, we have sometimes different perspectives, and sometimes it's like, well, actually in the Australian law, this is actually not okay. So kind of slowly building that in the conversations I have with them. And for some women, it's not until, you know, the 5th or 6th time I see them again, and they're ready, they've got the confidence, and they go, yep, no, this isn't okay. And I guess there's a lot of underlying things why women do stay. So it takes time for them to kind of feel safe to unpack those reasons as well. But I think in her pace and journeying with her and supporting her, and not making judgment statements or accusing her or saying, oh, I don't think this is right. But yeah, gently encouraging her through our support, and reminding her that her safety, her well-being, that she should be treated with kindness and respect and thoughtfulness, and just then how we embody that and how we treat her. So if we treat her with respect and go, yeah, that's your choice, I'm not going to force or pressure, slowly through time she sees that, but within the relationship it's all controlled. So, and I guess the evidence is it takes a woman 7 times to leave a relationship fully, and for often we know it's a lot more than that. But I guess we're planting the seeds, so having a positive encounter with every service intervention and planting those positive seeds, a few kind words, just that patience and spending time with her and listening to her and letting her express her thoughts. For a lot of women, they say they've never had the chance to safely express how they feel, and when they start doing that, when they actually hear their words, it goes in, it's psychologically ingrained. You hear it differently and you start thinking things differently. So that's, I guess, it's so important that we have safe places for women to just start that talking and thinking about it, to then start that reflection, and then slowly they get there.
Thanks, Cassie. Thanks, Shamindanai. we've done a lot of sharing. I just want to share something here, which is a little bit to the side. Lots of thank yous in the chat box before I get to the comment. But Sharani mentioned something quite interesting, because here in Australia, we are in the midst of there being, if you like, an uprising. We are in the midst of women actually saying enough is enough. The statement that Sharani makes is, when these men who give trouble to women are members of parliament in the ruling party or their friends, they have all the support to escape, while the victims have no voice at all. Those who raise voice to them also become victims of this vicious cycle. Sharani, I just want you to know, and Janine and Livia and many of our team are smiling, because we have had some horrific, unfortunately, some horrific accounts of abuse towards women within our own parliament in the last, well, it's been going on for a little while, but it's just come forward in the last few weeks. And there is a huge systemic change afoot, because it is incredibly shameful. And what it's done is it exposes something very systemic at the highest possible level of a country. So whilst on the one hand, it's shocking, on the other hand, the best thing is, and it fits in with what Cassie was saying, people have spoken out. People have been supported either through friends or programs or things like the things we've shared today. They've been encouraged and supported to speak up. And in that speaking out, it has confronted the country, it has confronted the highest parliament, and there will be massive change. There'll be further change. If you think what you've heard today from the Victorian perspective is quite impressive in terms of systemic change, wait till you hear what is going to happen to Australia nationally for women, because of the courage of women to speak up. And the only way they can do it is with the support of people like those you've heard today, and for people like yourselves. I just think, please give all the group, the three practitioners, Sakina, Jade, and who's the other one there, Cassie, a huge hand of applause, and also Janine and Livia again. Great sharing. And what I love about the sharing is it's something that it's all deep to our own hearts. We all have similar experiences at different levels. It's a conversation we need to keep having. And there may be, this is the catalyst for something across Asia Pacific within Good Shepherd to talk about systemic change or how things might happen. But I think this has been a wonderful sharing of the Good Shepherd network across Asia Pacific. I think it's been fantastic. I've been in many sharings, but I think today was quite exceptional. Teresa, I don't know if you've got anything you want to say around that as a conclusion.
I just want to thank the team from Australia and New Zealand for the sharing today. As I listen to you, I'm also very much aware that Good Shepherd itself is a system unto itself. And if we are working in the milieu of family violence, we really need to examine our own system and our own way of working in this area. And it seems like we have so many things to address because we are not looking at the system as a whole. And if we use the rights-based approach, it actually opens up so many doors for us to look at the different circles of care that surround the victim of violence. And I just want to thank all of you for opening up our minds to the fact that evidence-based research coupled with trauma-informed approaches, coupled with skilled people on the ground, and coupled with that whole Good Shepherd ethos and philosophy of working and empowering women really works. It really works right up to the government system. Thank you for showing us this way and this pathway of addressing violence within the family system. Thank you so much.
Thank you, Teresa. Thank you very much for sharing that. So at this point, we'll bring our session to a close. I'm sure that if you have any further questions or inquiries, you can email us and people may be able to give you some resources or some support in any way at all. And of course, this is being streamed to YouTube, so you can have another look or you can share. Please feel free to share with others who you think might benefit from what's happened today. So a huge thank you, but I also, from our point of view as Good Shepherd people from Australia, we want to thank you for putting the time aside to come along, and secondly, for what you've contributed. You've shared so much of your own experience. This has been a true sharing So we want to thank you as well. It's been amazing. And you've made a big difference to the whole session by being great contributors. Great to see you all. Really wonderful. Have a great rest of the day or night or whatever it is for you. And we'll see you again in the Zoom room somewhere else. Thank you, everybody, very much.
Thank you, everybody.
Thank you.
Thanks,
everybody.
So much.
Yes, open up your mics and say goodbye. Thank you.
Thank you so much.
Goodbye.
Thank you so much.
Thank you so much, Australia,
Bye-bye.
New Zealand.
Thank you.